So howdy, welcome to Texas A&M's Sustainability Talks. So this is our first sustainability talk for today, and we also have another sustainability talk today at 6 p.m. So we hope you'll join us for that. And that sustainability talk at 6 p.m. we'll be looking at what other countries are doing, their responses to COVID-19 and kind of some of the differences that you've seen based on the responses that these different countries have taken. So that'll be at 6 p.m. tonight. But you're here today for Virtual Earth Month, and this is a collaboration with TRAX, so Texas Regional Alliance for Campus Sustainability. We have these virtual events happening all across the state, and we have a whole bunch of them happening at Texas A&M. A few more happening the rest of this week. And today, for our sustainability talk, we have Molly Murphy with us. She is an environmental studies major. She is class of 2021, and she will be looking at mental health in relation to coronavirus. So really excited for this topic. I think this is a topic that a lot of people may not necessarily think about when they think about sustainability, but this is a very important component of sustainability, social sustainability, our mental health. During this presentation, Molly's going to give you, please ask if you have questions, and we hope you have some questions that you're willing to ask. Just throw those in the chat. I will ask those at the end. And also, if at the top of the screen, you'll see a green bar that shows that it's sharing my screen. And to the right of that, there's some dots. If you click on there, you can turn it into side-by-side mode, and that will be the absolute best way to view this presentation. So I encourage you to take advantage of that. So without further ado, I'm going to pass it over to Molly Murphy, and she's going to talk to us about mental health and COVID-19. So Molly, I'll stop sharing my screen, and whenever you're ready, you can take it away.
Okay, sweet. Okay, can everyone see it? Looks good, okay. So I'm Molly Murphy, and today I'll be talking about mental health impacts that are coming along with this pandemic. So first I'll be talking about the Spanish flu, what it is and its impacts on society at the time. And then I'll be talking about COVID-19 and what's going on right now, and then different coping methods to help you with mental health issues that you might be having right now. So the Spanish flu, what was it? So the Spanish flu started in 1918, and it was an illness that attacked the respiratory system specifically, and it weakened the bronchial tubes in the lungs, and bacteria was able to infect them a lot easier. It spread through coughs, sneezes, and talking, which is very similar to how COVID-19 is right now. And it's called the Spanish flu, not necessarily because it originated in Spain, but Spain was hit very hard by the disease, and they were able to report on it more thoroughly than other countries because they weren't really participating in the war at the time. And news at the time was downplayed a lot during the war to keep morale up. And, so sorry. And that was just to help with the soldiers and people at home not to worry as much as with the war and the pandemic at the same time. But there were a lot of soldiers fighting in World War I that were in such close proximity to each other that a lot of them died from the flu rather than fighting in the war. This left widows and orphans all around the world. 6 years following the disease outbreak, there was an annual increase of about 7 patients per year that were admitted into asylums. And this was a really big deal at the time because mental health issues like depression were more looked down upon in society. And most people didn't report their emotions to doctors like we do now. Back in the States, much like the authorities are doing today, all non-essential things like bars and restaurants and movie theaters were closed to prevent the spread of the disease. And some cities were even fining citizens that were in public, and especially if they were in public without masks. The contribution of a war plus the pandemic led to a widespread panic in the countries that it was affecting. And this led to an overall increase in mental health problems after the war and after the pandemic. And this is essentially what we're predicting to happen after COVID-19. So for COVID-19, there are a lot of different symptoms that the CDC are saying are common to experience during this time. These include, but are not limited to, constant worrying or fear, difficulty of sleeping and concentrating, changes in eating patterns, feeling loneliness and depression. And again, these are all really common things to be experiencing during this time, even if people you know aren't vocally expressing them to you specifically. And the state of our economy and unemployment rates rising correlate greatly with this increase in negative emotions that most everyone are feeling right now. Physical isolation is also playing a big part in feelings of loneliness. While we're connecting through Zoom and online platforms in many different ways, physical interaction with people is what most of us crave on a day-to-day basis, and people who have the most minimal amount of human touch are reported to have, or people who have the most amount of physical touch are usually reported to have a positive outlook on their day and on their lives. And in the age of technology, we have seen the implications of social media firsthand. And this can include issues with bullying and self-image and self-confidence. And unlike people during the Spanish flu, we can interact with each other even when we're not near each other, because everyone is on their phones and on their computers passing time. But long-term effects are predicted that for young children and adults are to have more social anxiety in public events after this pandemic passes. And there's a lot of deaths that are occurring right now, which can cause a lot of grief that many people don't know how to properly deal with. And this can transmit through generations, and social capabilities may decline for years. So there are many ways to deal with lessening the impacts of mental health from the pandemic on your mind and body. And the first one is to take breaks. So not just from anything, but specifically from the news and being just surrounded by the negative things that are being said and the stress of all of the different news channels and different stories being said. So it's good to take a break from those things, even while you should stay updated. Just don't watch it all day 24/7, because it's just not good for your mental health. And then the next one is to keep a routine. So while it's really easy to sleep in till 2 or 3, which I'm guilty of, there are so many benefits of having something to wake up for, whether that be just to make food for yourself in the morning. But waking up at 9 or 10 rather than in the mid-afternoon could help you feel more productive and feel positive about yourself. And then another thing, you can pick up hobbies and have something you practice every day. So I put like painting on here, drawing. I've personally been practicing my roller skating a lot. So just like having something that you can do to keep yourself motivated and not get too stressed out and throw off your whole schedule of life because we are quarantined. Next, I have to stay active. So you don't have to necessarily go for a full-on workout like 2 hours a day. Like that's a little excessive if you're not used to that, but just like going on a walk or doing meditation. I really like Yoga with Adrian and Chloe Ting. They have great videos that you can follow on YouTube. And while those are all great, just any type of activity would help with getting yourself out of the house. You can, even though we're quarantined, you can still go outside while following social distancing rules and just get yourself more motivated for your day. Up next, I have to be mindful. So while there are a lot of negative things and you shouldn't obsess over the news, there can be a lot of anxiety that comes with that. And while you are at home and doing these things, just make sure you understand that there are other people obviously around you and might not understand, like children, and you could be comforting to them and recognizing red flags that might be abnormal for them and keep them on a regular schedule like yourself or with your roommates or family members. And even though you shouldn't obsess over the news, it's also good to stay informed without worrying yourself or other people around you. Also, check up on your parents and your grandparents if you're not with them. The loss of jobs or working from home or being in the front lines as a healthcare worker can be more stressful than a lot of adults are putting on. And you should also check up on them, be comforting, and communicate with them to relieve pressures of the situation between each other. And lastly, staying connected. So I put some funny pictures just to lighten the mood. But FaceTiming your friends, calling your friends, texting can also provide you with support that you might be lacking during this time. Just because we're social distancing doesn't mean you have to cut off all communication with family and friends. Call your mom. So I focused a lot of like negative attention on these things, but I just wanted to point out the silver lining of a lot of this. So quality time, this is probably one of the only times in a lot of people's lives that they're going to be at home with their family or specific people or friends for such a long extended period of time. So you should take in that time. And while people might get annoying or stress you out just being in the same room with them all the time, it's good to just take in that time because you never know what will happen in the future if you'll be separated from them. Up next, we have the improvement of online resources. So this is a great time for school systems and healthcare systems to really work on their use of the technology. So for schools, working on how we're going to do online school when a lot of people are used to having to go to classes and physically be there with their professors, as well as for healthcare, like telehealth and doing therapies, whether that be physical or just normal counseling, working on those systems to improve them, which can be used in the future as well. An appreciation for the little things. So I know for me at least, going to Walmart or HEB is kind of exciting now because I can only go once a week, or I'm only supposed to go once a week. And just, it'll make us appreciate that going to the park or going to the movies with friends will be a lot more exciting once we're allowed out and aren't in fear of getting sick or getting other people sick. Then we have biotech. So as we know, there's a lot of rush to get a vaccine right now and lots of testing and issues trying to find a way to cure the coronavirus. And so I think that with all of that push for the vaccine, this will help further our capabilities as a society to push out a vaccine faster because of the need for it right now and the demand for a vaccine. And then for the environment, so there are also a lot of environmental things that are going on. I feel like everyone has seen the pictures of Venice with the clear water, the dolphins are returning, and then there's also been a decrease in emissions coming from factories or from transportation. And this could also show us that while we're not able to go outside and do all these normal things, it might be better for the environment to rebound from all of the destruction that we've caused, and could show us in the future how we could go about fighting climate change. And this is a map of the NO2 that has gone down. So this was before in January, and this is in February, the amount of emissions that have decreased in China. And so over here, I included different helplines. So the first one is the A&M Student Services line and their website, and then a couple of other numbers and websites that you can text or call or go on their website for any counseling or questions about any type of mental illnesses. And then these are some of my sources. And if there's any questions, I'm open to taking them now.
All right, awesome. Thank you, Molly. That was really informative, and I think just a really interesting take on the situation that we currently find ourselves stuck in, and just kind of make sure that we're thinking about how we can be productive, taking care of ourselves, and take care of other people. So I think that was a really informative talk. Now is the time where if anyone has any questions that they would like to ask Molly, we could use some here. Got her on the line. She's got a lot of good information. Oh, here we go. Got a question. That's awesome. I don't even have to come up with one. So, what do you suggest for people who have a hard time finding motivation to get out of bed and get active? Really good question.
So I'm right there with you. It is very hard to get out of bed sometimes, but something that I normally do is I open up my blinds before I go to bed. And if you don't wake up from your alarm clock, the sun will wake you up eventually. And I mean, setting alarms obviously is sometimes you'll sleep through them or whatnot, but having something to do in the morning and just knowing like, okay, I have to be up at least 10 to work on this, or setting a workout or a yoga time or something that you have to do at a specific time, and making it kind of like a game with yourself. Like, if I don't get up now, what am I going to do with my day? So just having like things to work towards and use those to motivate yourself.
So thinking about things to work towards, Molly, do you like use anything to like reward yourself after you've kind of accomplished what you set out to accomplish for that day?
Usually I will eat ice cream at the end of the day personally, or I will like after I work out, I'll probably watch like TV for a while and like it'll balance out. But just like little things like that, for me at least.
Yeah, no, I was asking because I kind of do the same thing. So I think it's always important to try to reward yourself, give yourself something to look forward to. It's like if I accomplish this, then I can do this.
Yeah.
So thinking about like routines, could you talk a little bit more about routines and how that can be helpful?
Yeah. So I really think like having a set routine is just important in day to day, but especially with quarantine, because if you don't keep a routine throughout your day, it's going to be even harder to go back to after quarantine and getting used to going back to work or going back to school or whatever it is you're doing. And I know it's hard for like a lot of us college students to not take the opportunity to sleep all day, because I'm guilty of it too, but it's also good to have that and just keep it as normal as you can. That way it doesn't feel like we're really in a pandemic, even though we know we are. It's something to kind of also distract yourself and be like, okay, this is something I have to do, and just keep that for your day to day to keep you on track. So we also don't like forget what day it is or what time it is, and you can just feel more secure in your day to day.
Okay, so we have a follow-up question to that, and that is, do you have a set routine for keeping up with your family?
For my family, we usually text. We have like a group text, so we'll send pictures. We're all kind of spread out, so we'll have one person send a picture of their pets and do all of that, or send memes or what we're doing for the day, so stuff like that.
So, speaking of pets, how have pets helped with your mental health?
So I have a cat. I don't know where she is. I grabbed her, but she's gone now. But so I have a cat named Topo Chico. She's really cute. Um, I personally take her outside and we play for like an hour or two a day, just to like both be outside and like see the sun and interact with, I don't know, each other, I guess, and just have something that's not school or work or anything else. And I really think that if you have a pet, whether that be a cat or a dog or a fish or a hamster, to just like take time out of your day to just like hold them or pet them, because like while they don't really know what's going on, it could also be a help to you just to be like have something that doesn't, and it's oblivious but it still loves you, and comforting them at the same time.
So I'm curious, you take your cat outside. I don't hear people doing that very often. How does that
Yeah,
work?
I have a leash for her, and so I'll walk her, or we'll go on, we have a balcony, and she just like runs around and I just watch her and we play.
That sounds really nice. So here's another question. It's a little bit more serious. So you mentioned that there will probably be increased anxiety after the pandemic. Are there any other things we can expect based on what you know about the Spanish flu or current information? Do you have any suggestions on how we could prepare?
So, well, based off of my research from the Spanish flu, it was mostly people dealing with like anxiety and depression from the amount of family members and friends that died from the flu, rather, and with the war, and just getting over the stress of everything being closed and everything not being able to open. And it's basically just that, but suggestions I have to prepare. I mean, mostly like keeping that routine and not letting yourself getting too out of it and not knowing what's going on with the news or with your life and just trying to keep it as normal as possible. That way, when things do start reopening and we can go back to a normal kind of society, it's not as a harsh, dramatic change back to that.
Yeah. Okay. Yeah, that's good advice. And then, so this is something else that you mentioned this during the course of your presentation, and you just mentioned how important it is to check up on other people in your life. So that's not necessarily really a question. You can say more about that if you want, but I just thought that was a really important part of your presentation is, all of us can take that time to check on people that we know or care about and just make sure that they're doing okay.
Yeah, definitely. I think it's a really good thing. Like a lot of people aren't able to go visit either grandparents or aunts and uncles and things like that right now because they are old and they could be vulnerable and it's just not worth the risk. But even now that we do have things like Zoom and FaceTime and text, like just a simple text and be like, hey, are you okay? I just think that's a really important thing. And a lot of them might not expect it if you're more of a distant relative or not, but it's just nice and could lift someone's spirits a little, even if they are or not sick. So
Yeah, definitely. And you can check on friends too. And like you
yeah,
mentioned, Zoom calls, like you could have Zoom happy hour or whatever with your family or friends and just everyone get on the screen and show each other your pets or whatever it might be. So I think there's lots of great things you can do. So I think you definitely gave us a lot of good ideas. And then I have one final question. First, they just want to start off by saying nice work, which I agree with. And then they also say, what about your research surprised you the most?
um, probably the with the Spanish flu. So it is really similar to COVID-19 and how it spreads and how it affects the body. But it was just surprising to me that in all of the research that was done over the amount of people that were affected afterwards, they only recorded about 6 or 7 people per year that were reporting symptoms and like coming out and being like, I feel this way and this is affecting me, which I thought was really surprising because nowadays there's a lot more people, like it's a lot more common to speak to your doctor and get professional help for any type of mental illness. So I think just the fact that we've come that far in society that it's okay to talk about that kind of thing, that was probably the most interesting to me.
Awesome. And I think it's great that you are willing to talk about this as well and in relation to sustainability and what we're going through today. So I think it's really important we have, brave people like you to talk about this topic that is, I think it's definitely becoming more acceptable, but there's still some stigma around it. So
Yeah.
thank you for talking about that with us today. So with that said, unless you have any other thoughts you want to give Molly, that's all of our questions for today. So that is going to wrap up our sustainability talk. We have a thanks, Molly. Great work. Thank you in the chat. Great work in the chat. Thank you, Molly. Amazing job is in the chat. Awesome job, Molly.
Thank
So
you.
I think you really did a great job today. Got some claps going on the screen. So thanks everyone for your support, for tuning in, for spending your lunch hour with Molly in the Office of Sustainability. So what we have, I mentioned at the start, so Faiza Hassan at 6 p.m., she's going to be talking to you about what other countries are doing, like kind of like what we're seeing in terms of responses from governments and what those responses mean for the spread of COVID-19 and the impact it has on people. So I thought it will be a really interesting conversation that we'll have at 6 p.m. today. And then tomorrow we will look at homelessness and COVID-19. So we had Jessica talk about that originally, and Thomas will talk about that tomorrow at 11. So a couple more sessions the next couple of days. We definitely hope you're going to tune in. And then just to end it off, we got a couple more. Good job, Maul. This was great, Molly. So good. So proud. So excellent work. And we'll hope to see all of you again tonight at 6 p.m. Please join us. And then one more time, thank you, Molly. Good job today.
Thank you for tuning in.
Thanks for tuning in, y'all. Everyone take care. Stay safe.